Hi, this is Dr. Bob Dannenhoffer. It's June the 26th, and we're doing another one of our Facebook Live updates. I'm wearing my new fashionable balaclava. This now go down to my shirt, so you don't see that little patch of hair there. Anyway, so I'm going to take this down so those who read lips can see what I'm saying. So again, Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County, with another of our Facebook Live events. This is a time for you to ask questions, and I've heard there are lots of questions today, so I'm ready for it, so go ahead and send them. But while you're putting those there in the chat section, we'll go ahead and talk about what's happening in the world. It's pretty grim. You know, I've been doing this since the early part of March, so we've done over 30 of these so far, and there have been a couple of times I've been a little dejected, and unfortunately today is one of those days. And I'm a little dejected today because what I'm seeing over the last week or so is a real escalation in this disease worldwide and in the U.S., and that's a bit scary. So we're just now short of 10 million cases and 500,000 deaths. I mean, this now becomes a truly worldwide issue when you think of how many deaths we've had from other diseases and wars. 500,000 deaths is a lot. And it's really increasing. So we've never had a day with more than 150,000 cases until the past week, and now we've had 5 of the last 7 days with more than 150,000 cases. And it took us months to get to the first millionth case, but less than a week to go from the 9th to the 10th millionth case. So it's really worrisome. We're seeing lots of activity in this disease worldwide. The US, India, Bangladesh, Peru, Chile, Mexico, Pakistan. And so it's really all over the world, and especially in the equatorial regions. And we're still adding about 5,000 deaths per day, and that doesn't seem to be really going down. So when we look at the new death rate, the thought is, well, maybe the cases would go up, but the deaths would start to really come down, and we've really not seen that. So clearly these are not asymptomatic cases, and worldwide it's different. New Zealand, just a few cases. Australia, less than 100 cases a day. In the whole European Union, with about 450 million people, they only have about 18,000 cases, where in the US, we have 40,000 cases and only 2/3 of the population. So really active and really worrisome. So in the US, we're at 2.5 million cases and 127,000 deaths. Again, that's a lot of deaths. We didn't think we would hit 120 until July or August, and here still in June, we're at 127. And still, if you look at it and do the math, 127,000 deaths, 2.5 million cases, we're still hovering around a 5% case fatality rate, and that's a lot. So in the US today, we had 44,000 cases, which was far and away our most ever. And so as we were thinking in the summertime, we'd start to be kind of done with this and go back. And unfortunately, what we're seeing now is the most cases ever. Florida had 8,900 cases. So Florida, which is bigger than Oregon, but not that much bigger, had more cases in one day than we've had all through. Texas had 5,500. California had 4,000 cases. So lots of cases along the way. And while many of these cases are younger people, they're really starting to strain the hospital system. So Texas, which was one of the states that opened big and opened loud, they today stopped elective surgeries in some hospitals. They've repurposed their children's hospital to take care of adult patients. They've closed down bars. They've restricted restaurants. They wouldn't have done this unless what they're seeing on the ground is indeed quite worrisome, and I think it is. Arizona especially is very worrisome, and the reason Arizona is worrisome is that they do have an old population, much older than Texas, and so the concern is that early on these cases may have been young people, but older people live with younger people. If they're in nursing homes, the people care for them are younger people, and so we do worry about what's happening there. So the worldwide situation is pretty grim. You know, we were pretty grim in March and early April, and then starting in May, things started to get better. But I think now in June, I'm worried about where we're at. In Oregon, we had 250 cases today, one of our really highest totals, and about 7,800 cases. So while it seems bad in Oregon, it actually isn't. We still have the 5th lowest attack rate and the 5th lowest death rate. So the attack rate in the state is about 18 per 10,000. So remember that number, about 18 per 10,000, was a relatively low attack rate in the state. In Douglas County, we're still adding just a few cases, but we're only at 3 per 10,000. So we're 1/6 of the state rate, which is about 1/3 of what the national rate is. So we're much, much, much lower than you would think. And so Douglas County is doing pretty well. Now, people have said, well, this is because we're doing more testing. And some of the increase is because we're doing more testing. So I looked at the Oregon results, which I think are pretty accurate. In May, in 1 week, we did 16,000 tests and had 255 positive. That was pretty good. A relatively low positivity rate and a reasonable level of testing. In June, our testing is up to 27,000, but there are 1,137 cases in that last week they looked at. So if it had just been more testing, you'd have expected that the case rate would have gone from 255 to 400, but instead it went from 255 to over 1,100. So maybe 400 of this, so maybe 150 of those additional cases are due to more testing, but 700 of the cases are because there's more disease. And I think that's what we're seeing, is there's more disease around. So when we look at this, we're seeing more disease in the areas that have disease. Now, at the same time, what is striking and nearly amazing is in places where there's very little disease, there's very little disease. So in Douglas County, we have tested different groups at different times. And when we test big groups, we're not finding any. Again, they did this trace study from OSU where they looked in Corvallis, which also has a similarly low rate. They didn't find any out of 1,000 that were positive. Mercy's done over 1,000 pre-ops, all negative. And so this really does seem to be a disease that's in pockets around the state. And one of the pockets where it's not is in Douglas County, which is a good thing. So you say, well, why did we then have a couple of cases over the last 2 weeks? All of the cases over the last 2 weeks are associated with out-of-state travel. Either people from Douglas County who went to another place and brought it back, or people who came to our county and brought it here. And so that's what we're seeing. And since travel is still allowed in the US, we have to be incredibly, incredibly careful with when we go to outside the area or when people from outside the area come to us, because that's where it seems in Douglas County now the disease is. The good news is in almost all of these cases, we got them early, we've done quarantine and isolation, and we don't think there's going to be further spread, but we know there's going to be further travel. You know, I sort of go over the freeway several times a day and see how much traffic is there. You know, during early April, when we were really locked down, the freeway was pretty empty, but when I was driving the other day, it looked like the old days. And, you know, I used to come around to downtown here to do this thing. There were plenty of parking spots. Today, there were no parking spots. So, you know, people are moving around more and doing more. So this is really the risk that people are going to get this disease, go to a party, go to a graduation party, go to a birthday party, and bring it back. So I think we have to be really, really, really careful, because right now we're doing okay, but I can see that within a week we could be from doing okay to being overwhelmed, and that's where we don't want to be. Okay, so Laura says, I'm so confused about the numbers, and I'm confused about the numbers too, but I think I know the right answer. So this comes because everybody has deadlines. So the OHA does a deadline where they pull the cases at midnight, and when they pull the cases at midnight, then they present them sometime during the day, anywhere between 9 a.m. and 4 p.m. when they make their announcement. So they start at midnight. The news can either pick up from the OHA thing, or they can pick up from us, or they can talk to us, and they get a different number. We pull the cases as soon before noon as we can, and then do them at noon. So all of our numbers have been correct at noon. And so we're giving you news which is 12 hours more up to date than the states. So for example, some of these cases came in yesterday during the day. We reported some yesterday, and OHA did report them to today. However, if you look at the total number of cases, they always match up. Now it's confusing because definitions are changing. And so that, for example, the definition of a presumptive case changed again today because of a thing called an antigen test. Well, it hasn't affected us at all, but there are some changes. But the numbers we give you every day at noon, if you look at our press release, are the most up-to-date and the most correct. I think in the whole time we've done this, there's only been a day or two where we've been off by one or so because of a technical reason. So if you really want to get the numbers, look at our daily press release. That is the numbers, and they'll get there. So are there a lot of sick folks being tested? Yeah, The answer is no. There are very few sick folks being tested. So when we started doing the testing in March, almost everybody was sick, and there were a few people getting it for other reasons. When we do the testing now, almost everybody is getting the test for a different reason, and there are not very many sick people getting tested. That could either mean there aren't very many sick people out there, which I think is probably true. I work in the clinic. We've not seen a lot of sick kids. Usually in a pediatric practice, because of cough and fever and pneumonia and everything else, we just haven't seen very much of that. So I do think the amount of illness is down. But I'm also worried that people who are sick are not getting tested. So if you have any symptoms suggestive of coronavirus, and we'll go through a few new symptoms today, then please, please, please get tested. Some tests are taking longer, and that's because what they're doing now is they're prioritizing tests. And the first priority tests are people who are hospitalized or are going to be hospitalized. And since that makes up a lot of tests, those go to the front of the line. So this is, for example, people who are having elective surgeries. So those are going. So other kinds of tests are sometimes pushed back a little bit, but almost all of our tests are done within 48 or 72 hours. So somebody says, I'm really concerned about Reedsport. People are flocking here. Is there a possibility to shut down beaches again? I certainly hope not. So I'm going to be out in Reedsport tomorrow doing some testing at the Public Works. So if you want to come say hello in person, come by Public Works tomorrow, right by Sandy's Donuts. But anyway, I will be there. Yes, there is a possibility to shut down again. So when I heard today that the governor of Texas shut down bars and restaurants and shut down elective surgery, that was really worrisome. Texas has had kind of a bit of bravado in this, like, oh, we'll get past this, no big deal. So for them to shut down elective surgeries, for them to close bars is really worrisome. And for me, closing down again, I think is really, really worrisome. Early on, a place had to close down. There were these PPP loans that you could get that would help you with payroll along the way. These are forgivable loans. So for many businesses, they were able to push through with those, but those are coming to an end very quickly. In addition, there are some businesses that said, well, we're going to use this opportunity to go to, do some upgrades or to do some things that we aren't going to do, or just take a few weeks off work and relax. And so this first time, even though it was incredibly painful, was for many businesses doable. I think now, if you've called everybody back and you're starting doing it and now you're going to be closed down for another 2 weeks, I think that's going to be a problem. And I think shutting down beaches, it would be one of the things we would shut down. And again, I know Reedsport lives and dies by tourism, and so I really worry about that possibility. So my plea to people is, let's not spread this. So if people want to go dooning, that's just great, but stay away. Don't have these big after dooning parties. Don't go to the bar afterward and talk about your great adventures. This is really where it spreads. We don't think there's very much spread outside, so we think outdoor activities are safe. But bars really do seem to be a big issue, and parties seem to be a really big issue. There was a report in Texas this week about a party, about 25 people at the party. So not an illegal party, but 25 people, pictures of the party with everybody hanging over each other. 18 people got sick, and 3 really critically ill. And so this is exactly how it spreads. One of the people came, was working a construction job, thought he had this nagging cough because of dust. Not an unreasonable thing, but spread it to all of these other people at the party. And that's exactly how it spreads. And that's why both Texas and Florida are considering shutting down bars, because bars have really seemed to be a place where this spreads. Now, Oregon has opened up bars. And so if you go to a bar, be very, very, very careful. So someone says, will a vaccine be effective for a person with a severely suppressed immune system? And I don't know. Most of these vaccines that are out now require an intact immune system to make enough antibodies. So we don't know if it will. These are mRNA vaccines, seem to be the leading ones. And to have an mRNA vaccine work, the mRNA has to get into your cells that can now make this protein. It makes the protein, and then your T cells and B cells help you to make antibodies. And people with weakened immune systems may not be able to do that. But this is the same with almost every disease. So we know that there are a bunch of kids who cannot get measles, mumps, rubella vaccine. They can't get it because they have really weakened immune systems. So there are 2 little guys that I take care of that have heart transplants, or 2 little kids. that have heart transplants. And with heart transplants, you're not supposed to get live vaccines, so they can't get live vaccines. So what do we do for them? Well, we hope that everybody around them is going to have a measles vaccine, so they'll never come in contact with the measles virus. So the hope would be that if you have a severely depressed immune system and your body can't make a vaccine, that everybody around you will have antibodies so that this virus will never get to you. And that's why we want to have a high enough level of community immunity so we can prevent that. Yeah, so Kat says, I keep thinking that having a good immune system is the best way to prevent or minimize illness, but what about the cytokine storm? So this is a really, really, really weird illness. So my best understanding of it, it starts as a respiratory illness. And for many people, it starts as a respiratory illness, and it's so mild you don't even know you have it. Although, interesting study from this week showed if you look at those asymptomatic people and do careful CT scans of their lungs, they do have some lung changes. So they probably do have infection. It's probably in their lungs, but they don't even have any symptoms. They have no cough, shortness of breath, or anything else. So for many people, you just wind up with this respiratory illness, but then some people start to get this big inflammatory response, and they seem to get this big inflammatory response at the same time they also get vascular disease. And this inflammatory response is called a cytokine storm because there are all these little proteins that your body has that tell your body to go ahead and make inflammation. So these are things like tumor necrosis factor and interleukins and stuff like that. And so you can measure that when people are having the cytokine storm, they'll do it. So that goes along actually with some new data that came this week. So you remember last week we talked about Decadron, which was a steroid, which seemed to help people who were in the cytokine storm. But data this week suggested if you give it while it's still just a respiratory illness, it actually makes them worse. So that would go along with this, that in the beginning this is a respiratory illness that your body's starting to fight. At some point it moves over to a vascular illness, in which time that amount of inflammation is hurtful to you, and that's why steroids would work. So what about having a good immune system? Well, we think actually having a good immune system is what produces the cytokine storm. And that's why Decadron would work, because it would decrease your immune system. But this is all stuff we're just learning. Still, overall, we think the best thing you can do for this is to stay healthy. Get sleep, eat well, get some exercise. We think that's the best thing you can do besides avoiding getting the disease. Yeah, so Brittany says, I said on Monday that I wasn't worried about kids getting it, but can they carry it home to us? They may be able to, but I think there's really good data now that there's 3 differences in kids. So that if it goes through a population, the percent of kids who get it, even if you test them asymptomatically, is lower than the population. That when they get it, they get less sick, and they tend to spread it less. So I saw 3 outbreaks today that were in child care centers. None of the outbreaks were kid to kid. They were all from parent to kid. And so it looks like kids may not be able to spread it to others. Now that's very different from every other disease we have out there. So if you have a disease like hand, foot, mouth disease, or flu, or any of those things, what happens is they circulate like crazy among kids, and then they bring them home to their parents. This one does not seem to do it. And that's a bizarre thing about this virus, but one of the more bizarre things that we see. Now, this may not be true, right? We may, as the data comes in, find out that they really are spreading it, but at least the data from other places that have opened up schools, they've not seen big outbreaks in schools. So New York is going to quarantine people who travel to the area from the other area. Should we start doing the same? So if I were in charge, yes. So if somebody was coming to this area and they asked my advice always is quarantine for 2 weeks before you start circulating here in Douglas County. Now, it's really hard to do if you're only going to be here for a month, right, to spend 2 weeks in quarantine before you get out and do it. But that actually would be safest. You know, Alaska has this plan where they want everybody to go to quarantine before, and they've changed it recently with testing, which I think is ridiculous. But yeah, actually, when you travel to quarantine is not unreasonable. And if people asked me if they were coming from California, what should they do? I'd say quarantine for 2 weeks, before you start circulating here in Oregon, because if you come, stay here 2 or 3 days, have gotten the disease down there, you don't even know you have it yet, and they'll start going out to the supermarkets and restaurants and whatever, you could spread it. And it doesn't take very many people to spread it to a bunch of people. And then if some of them spread it, you can see how this multiplies so very quickly. So yeah, I think I would. So is it best to just stay in the county? Yeah, yes. So if you can stay in the county, stay in the county. I mean, it's not like we don't have the most beautiful campsites. Not like we don't have the most beautiful hikes. It's not like we don't have pretty darn good restaurants and everything else here. And I know people do want to travel, but again, travel is a real risk because you can go to an area. Let's say I want to go up to Lincoln County to go camping. There's a lot of disease in Lincoln County centered around the Pacific Seafood Plant. And if you went up there, happened to sit in the restaurant 3 feet away from somebody who was sick, and maybe they didn't even know they were sick, you could get it and bring it back. So yeah, limiting travel is a pretty good thing. So Luann says, if I need to travel out of state, can I get tested without a doctor's order, and what's the cost? So you cannot get tested without a doctor's order, but you can easily get a doctor's order. So if you don't have a regular doctor, you can go to the urgent care. You can call Aviva at 541-459-3788. Yeah, and they'll go ahead and get an order and we'll do it. However, I would not ever use a negative test as a reason, as the get out of Douglas County free card, because getting a test before you leave Douglas County is so unlikely to be positive, right? Less than 1 in 1,000 of people tested in a low-risk county like Douglas County. So Douglas County, Deschutes County, Benton County, all these low-risk counties, if you look, the chance of a positive test is less than 1 in 1,000. Actually, the chance of a false positive test is greater than a true positive, but that's for us nerds here. But the problem is, you'll get the test and you think, oh, I'm good to go. But then as you go across and go to the new place, you can get it there, or you can get it during your trip. I mean, unless you're going to travel in a hermetically sealed thing where you don't have any contact with anybody else, you're going to go ahead and perhaps bring it. So this country has a fascination with asymptomatic testing, which is absolutely ridiculous. When the story of this gets written, it will be that the U.S. squandered tremendous resources on asymptomatic testing that was useless. Again, the countries that have gotten this under control, Australia, New Zealand, the EU, they have not done lots of asymptomatic testing. Asymptomatic testing is just a bizarre little US thing, and I haven't exactly figured it out. So, do you think the governor will make the entire state wear masks? Nagel asks. Well, so what can the governor make anybody do, right? So for some things, the governor can make people do things, but something so private as wearing a mask, again, we don't have any mask police here in Douglas County, so it's not like anybody could stop you and make you wear a mask. Now, can the governor, as she says, plead, cajole, be nice and have you do it, ask people to be kind and wear masks? Yes, and I think she may well. Actually, that is the recommendation of public health people, is that people wear masks. But I think the other thing is we've really politicized masks. Really, absolutely, positively, truly, the best thing you can do is to limit travel and socially distance. You know, if you socially distance, wearing masks is not consequential. So if you're always 6 feet away from people, as I am here, I don't need to be wearing a mask. The only time you really need to be wearing a mask is when you cannot assure social distancing. So imagine if you're in a place like New York City and traveling in the subway, there is no way you can assure that you're going to be 6 feet away from people. If you're in a crowded room, there's no way to assure you're going to be 6 feet away, and then you do need to wear a mask. So for people who don't want to wear masks, simply socially distance. If you socially distance, you don't need to wear a mask. You only need to wear a mask when you can't socially distance. And that actually, socially distancing, is the number one thing you can do. So Mary says, is the food from places that have outbreaks safe? We think so. FDA came out with something this week, thought that the food supply, there were no cases that were traced to the food supply. Now in China, they were worried that some salmon that came from somewhere else may have had some viral particles on it, but we don't think that's a source of infection. So I think the food from those places is safe. I don't worry the least bit about the food that I get. Yeah, so Paulette says, can a blood type make a difference in the symptoms? Have they done more research on this? There's a lot of research on this now. It seems like A is a negative risk factor, O is a positive risk factor, meaning if you have A, you're more likely to have worse symptoms, O, you're less likely, and B is somewhere in the middle. So yes, people will look at this. And again, we don't know if it has something to do specifically with the blood type or things that go along with the blood type. So what I always tell people is that people with blonde hair are more likely to have blue eyes. People with dark hair are more likely to have brown eyes. That doesn't mean the dark hair causes brown eyes or the light hair causes blue eyes. They're just linked. And it may be that it has something specifically to do with the blood type, or it may have something to do with the link on the blood type. So I was around my granddaughter 2 weeks ago. So far, no COVID. Yes. Am I clear to be around her more? Yes. Or could she get it and be carrying it at any time? Yes, she could. But again, as we said, kids are less likely to carry it. So it is much more likely, it appears, that grandparents will give it to the grandkids than grandkids will give it to the parents. Now, that's not true about grown children. We think actually people in their 20s, 30s, and 40s are probably the most contagious. So I don't know how old your granddaughter is, but if she's 27, I'd be worried about that. If she's 27 months, probably less. So what do I think about dexamethasone as treatment, Brandy asks. Well, dexamethasone is the generic name for the brand name steroid called Decadron. And as we talked about last time, I've used Decadron a lot. In fact, it is our go-to drug for kids with croup. And the dose we give is 6 milligrams in babies, which is exactly the same dose we're giving big adults. So it's, I think it's safe. Now the question, is it effective? So that study that came from Oxford actually was printed this week. And what it showed was that for people who had mild disease, weren't on oxygen, didn't have a lot of other things, it didn't help, and in fact probably hurt. But if you were sick enough that you needed oxygen or were in the ICU, it probably did help. And that would go along with our sense that early on this is a respiratory disease, that your immune system is doing a good job fighting, but then at some point it tips over to a vascular disease where you start getting other kinds of issues, including kidney failure, blood clots, and stuff like that, and in which case then it probably does help. We're going to learn a lot more about this. So when something comes out like this, everybody who's treating a lot of these patients is trying all these things out. So we'll learn a lot more in the next few weeks. So do you think county leadership should be more vocal in encouraging the wearing of masks? How much more vocal could I get? I mean, I always wear my, I don't think anybody has seen me around town for the last 6 weeks without me wearing a mask or my balaclava. And so, yeah, you need to do it. So we're trying to be good models. So if you look at the several press conferences we've had, everybody had a mask on and everybody was socially distanced. So we're trying to do that. I think, if there are others you would like, put them in the comment thing and I'll talk to them about making a statement about wearing masks. I think, when we talk about the other people in the county, what I've talked other people, they say, look, I think everybody should wear a mask. I'm not about to tell people what they should or shouldn't do, but please wear a mask. So I'm not telling people what to do. I'm just pleading with you to go ahead, socially distance. Be careful about gatherings. And if you can't maintain social distance because you're in a crowded place, please wear a mask. So how many people here are tested each day? Well, you can see on we know our number, so we can figure this out for you, but we have the negative daily test total. And if you go by that each day and subtract out, you can see how many tests we're doing. So we're about 4,500 tests now, averaging about 100 or so tests a day in the county. And that's from various places. So some of that is from our drive-thrus here in Douglas County. Some is from the drive-thru in Reedsport. Some of it is at the hospital where they're doing people who are pre-symptomatic going in for, or asymptomatic going in for surgery. Some people who are asymptomatic going in for surgery at other hospitals. So if you're from Douglas County and you get a test in Portland, that counts as a test on the Douglas County resident. And some are from people who are symptomatic. But when I talk to the people at the hospital, they're seeing very, very few symptomatic people. So the state looks at all the ED visits and they say what percent of the ED visits are for something that could be COVID, cough, fever, shortness of breath. And the number has been in the state 0.6%. So only less than 1 out of 100 people who are coming to the emergency room are coming for COVID-like symptoms. And of those people who are coming for COVID-like symptoms, only about 1/10 of them actually have the disease. So again, there's not a lot of symptomatic people out there. We're testing about 100 a day, and that's what we're seeing. So Tony said early on, people were saying the virus became inactive at 77 degrees. I haven't seen anything regarding this. What's been found? So I think it's 77 degrees Celsius, which is over 100 degrees. So 77 degrees Fahrenheit is only 20-something degrees Celsius. Yes, we do think at over 130 degrees or so, the virus becomes inactive. And that's not unusual. Most viruses are not particularly heat tolerant. Now, 133 degrees Fahrenheit doesn't happen very often in our life. And, you know, even in the countries where they're seeing a lot of disease, Brazil, Pakistan, it gets hot, but not that hot. And so it can inactivate it. What I did see this week is that Ford is coming up with a feature in their cars where you can turn the heat on to kill the COVID. You get out of the car and it heats the car up to over 135 degrees for 15 minutes, and then hopefully that kills the virus. I don't know. It's interesting. That could be a way to inactivate it. Certainly that's a way you can inactivate it on equipment. I mean, we for many years have sterilized equipment in the office, and the way we do that is with heat. So that's not surprising. So I don't think it's 77 degrees Fahrenheit. It's 77 degrees Celsius. So Patty says, our in-laws want to come visit from California. They're not quarantining, and we have an elderly woman that lives here, and we don't know what to say. Have them give me a call, right? You know, the last thing they want to do is come from California and make this little old lady sick, right? So what they need to do, if they really want to come and be safe, don't worry about a test. What they need to do is they need to figure out the day they're going to get here, say July the 14th, 14 days before that. They need to quarantine themselves at home, not go out, not do anything else. And then when they travel up here with minimal contact, and then they'll be safe. All the testing, even if you tested them every day, you'd only pick up 60% of the time if they were positive, and nobody's going to volunteer for a test every day. So Scott says, are there any phase 3 results from the vaccine trials? So they're just starting the phase 3 trials, so we don't know. What we do know from the phase 2 trials, which had scores of people in them, not hundreds, scores of people in them, and they were relatively young, healthy people. What we do know from those is that there were no significant side effects in that small number. What we do know in that group is that they did not seem to get that sick when they got it, although with the higher doses they did have fever and achy arms, and that most of the people produced antibodies. What we don't know is that if you expand this population, will it work as well in old people like me as it did in these young people? Will the antibodies it produce actually stop the disease from spreading? And that when you do more people, tens of thousands of people, are you going to find some rare condition? So people may remember back in the 70s there was a swine flu thing, and they made a vaccine, and there was a rare complication called Guillain-Barré syndrome. And Guillain-Barré syndrome causes a paralysis, pretty serious, and it did seem to be related to that. And you didn't find that though until you'd given hundreds of thousands of doses. So we're still waiting on that. So the question is, will it work in other populations, older and younger people? Will those antibodies actually do something, or will it just be interesting that it makes those? And then third is, are there some rare side effects that we don't know? And that's what phase 3 trials are about. So you need to get a lot of people in them. Yeah, so Travis says, please address the rise in unintended deaths because people are afraid to go to the ED. This is an interesting thing that I don't know if we're going to figure out the answer to anytime soon. But what we have seen is that in the areas where we've had a lot of COVID, have had a lot of deaths in that area, many of which have been unattended. And one time I teared up here on this thing is because my cousin, who was a New York City cop, spent much of his days going to apartments where there was unattended deaths and waiting until the coroner could pick up these people who had unattended deaths. And it's hard to know on those unattended deaths were these people with COVID who just said, look, I don't want to go to the hospital and died at home. Were these people who were having MIs or heart attacks and they said, oh, I hear the hospital is a bad place to be. I think I'll wait this one out, and actually died of that. Or were these people who had something like a stroke and they just didn't want to go to the hospital, didn't want to call 911, and so just died. So I don't know the answer yet. It's possible that some of those unattended deaths were COVID. It's possible that some of those were heart attacks or other things. And I don't think we'll know, but at some point we should. And that's why we have to point out that it is safe to go to the ED. Again, there's been no cases in the hospital for a long time. It's safe to go. It's far less safe to stay home with a heart attack because there are so many great things they can do for you for a heart attack or stroke at the hospital that they can't do for you at home. So if you think you're sick enough to go to the hospital, please, please, please go to the hospital. So Andrew said, would I feel comfortable eating in a crowded restaurant right now? No, and I wouldn't. And will I eat at a restaurant? Yes, there's a place I have breakfast most mornings, but I'm 6 feet away from other people, at least 6 feet away while I'm having my breakfast, and I feel safe there. But if I was unable to socially distance, or people who were within 6 feet, or it was just overall crowded. So interesting thing came out today that that the size of the people in the restaurant seems to make a difference because, or the size of people in the gathering, because in some of these super spreader events, you don't really need to be within 6 feet. Actually, for example, in this choir practice where 50 of 60 people got the disease, it was hard for them to remember being within 6 feet of the person who got it. So it may be that super spreaders are such good spreaders that they can spread even further than 6 feet. So the more people you have in a room, the more chances it's a super spreader, there's more chance you'll have it. So I wouldn't go to any room that had more than 25 people in it, regardless if it was a restaurant or a church or anything, because it's that crowded. Now, my risk tolerance is not that great at this point. I mean, I know I have this important job to do with public health, and I really don't feel like I could get sick. If I was out for a few weeks, it would put a big burden on the other people who work in the department. So I'm super duper careful about not getting sick. Other people might say, Bob, you're being a ninny, take a little bit more risk, and that's up to them to do. I know certainly young people are willing to take more of a risk than I would, but I would not go to a crowded restaurant right now. Would I rank out people if they did? No, but I think you do need to be careful, and I think you especially want to be careful where you have contact which is close, where you have contact which is exuberant, people singing, shouting, those kind of things, or a place where you're together for a long time. So it really is a combination of all of those things. It's long exposure, close exposure, exuberant exposure, indoor exposure. Those are the four things I look. So outdoor exposure, much less risky. Just the passing in the hallways, not really risky. Now, people are worried. So I talked to a fellow the other day about a planned gathering where people were together for 3.5 hours. And these were moderately high-risk people who were together for 3.5 hours. That's indoors. And they would have some spacing, but there was some shouting involved in the activity they were doing. They were going to be together for 3.5 hours inside an area that they said did not have good ventilation. That's a pretty high-risk event. He said, well, I'm at a place where I'm at an entrance to a place, and I see people all day coming past me, walking past me in the lobby, and I haven't gotten it, so I think that's low risk. The answer is, I think that is low risk because the people passing you in the lobby are passing you for 30 seconds at a time maybe, and they stop to say hello maybe a minute, and in a big lobby where the door's opening and closing and there's lots of airflow. This is very different from sitting next to somebody for 3.5 hours and shouting every now and again. So again, you have to look at the risks. Crowded restaurant, moderate risk. So Jamie says, is the rapid test that is done as accurate as a standing test? So there are two kinds of rapid tests. One of the rapid tests is an antigen test. An antigen looks for the protein that's on this virus. We think that test is not particularly sensitive. We do not know the specificity, meaning how many false positives there are. We don't think it's very sensitive, so the FDA says if you have a negative on this test, you should repeat it with a more sensitive test. That's on the antigen test. The other one are the rapid tests like the Abbott ID now that we've heard about so much. Those are problematic tests in that they're only probably about 50% sensitive. That is, you've had 100 people walking in the door with the disease and you tested them all, only 50 would show up as positive. The other thing we're seeing with that is it is pretty darn good specific. It's about 99.5% specific, which in any other world would be a good thing. But for this disease, where we think the likelihood of having disease is less than 1 in 1,000, if 5 in 1,000 are positive, false positives, for every true positive, you're going to have 5 false positives, and that is totally unacceptable for test. Now, if you were at a place where half the people had the disease, that rate of false positivity wouldn't be a big issue. But in our county, where we have a very low level of disease, that is a problem. Okay, and a few more things here. So, CDC came out this week, and they said, based on our seroprevalence studies, we think 10 million Americans may have had this illness. And the answer is, I think they're probably right. That would mean that there are 2.5 million cases we know about, and that they would say there's 10 million. That's actually not shocking because we know early on there were a lot of people who didn't get tested, couldn't get tested. We know there are a lot of asymptomatic infections. And we know even now there are people who have symptoms who are not getting tested. And I hear about this every day when we go through our things. For example, we heard about a story today. Somebody had fever and cough back in early June in a different state. They did not get tested because there was no easy, cheap, reasonable way to get tested, so they didn't get tested, and they likely had the disease back in early June. That's a tragedy. So the fact that we're missing cases, absolutely, we're likely missing most asymptomatic cases. We're likely missing many mildly symptomatic cases, and we may be missing symptomatic cases of people who didn't get tested. So that would suggest there was 10 million people got it. Now, for the people who say, well, this disease has a mortality of only 1 in 10,000, I heard somebody say, or 1 in 1,000, let's look at this number. CDC says 10 million. We know we have 127,000 deaths. That's an infection fatality rate of 1.27%, which is almost exactly what the infection fatality rate they calculated to be in the Bronx, which is almost exactly what I've told you the infection fatality rate is going to be, somewhere between 0.5 and 2, which means that if we don't get this in control in the country and 80% of the people get it, we're going to have a lot of deaths. So is there any place in the county that is doing N95 mask testing? Well, there is. DPHN, which is the Public Health Network, is doing this N95 fit testing. And the person who's writing these questions for me, Chris Rutledge, is the person who's doing that. So if you will send an email to ppe@douglaspublichealthnetwork.org and ask about that, I think we're doing these on Wednesdays. Okay, so we'll do fit testing. So what fit testing is that N95 masks fit very tight, so much tighter than the regular surgical mask, the little things you pick up at the drugstore, or these cloth masks. And what they are there to do is to protect the user from getting the disease. Not to protect me from giving it to you, but to protect me if you had the disease. And for the most part, we use these in tuberculosis outbreaks. So if somebody else has tuberculosis, I don't want to be getting the tuberculosis. So what we do when somebody has tuberculosis, we put a cloth mask or low-quality mask on them to prevent them from spreading it to me. And then I need to wear a very high-quality N95 mask, which does protect against 95% of those little particles. If you've seen when we do the swabbing, as I said, I'm a ninny and I don't want to get sick. So that when we do those, we use those hoods and whatever, which are N99.7, which protect against 99.7% of the germs and give the very highest level of protection. But yes, if you want to have N95 mass testing, ppe@douglaspublichealth.org. Our hotline is still up every single day from 8 to 5. If you have questions, please give us a call and we will go ahead and do that. So is there a test to see how good your immune system is, Donna asks. I wish, right? Wouldn't that be great? You know, like you can see how good your blood count is. You can see how good your kidney function is. Wouldn't it be great to see if you could do a test that could see how good your immune system is? There are lots of little tests you could do along the way, like you can look at your T cell count and your T4 count and your T8 count and your B cell count, and you can look at your antibody levels and whatever, but I don't think there is any one particular test that can tell how good or how bad your immune system is. So I hope that what's going to come out of this is that maybe we do have that, so you could do an immune panel and you could see how good your immune system is. Well, what can we do to make your immune system better? So we think things that we can do to make your immune system better is all those things Grandma told you to do: eat well, sleep well, get some exercise. We think getting a little sunlight probably improves your immune system. We think being in contact with soil germs improves your immune system. So going out, working in the garden, digging dirt and whatever, we think all of those things are good for your immune system. But as best I know, there's not a one simple test, like a thyroid function test, that could tell about your immune function. If you could think of a way to do it, Donna, we'll get together and win a Nobel Prize. So Nagel says, still don't understand why we can't know how many cases in each town. I mean, really, truly, it's spread throughout the county from people who've come in from outside. So from the south part of the county to the north part of the county, it's there. And again, if you knew there were 3 cases in, and I'll pick a place, Glide, or 11 cases in Glide, or 0 cases in Glide, it should not for 1 second change what you're going to do. And because if we said, there was a extraordinarily ugly 64-year-old man in Roseburg, they know immediately that it was me. And we're trying to really protect people's privacy. And the reason we're trying to protect people's privacy is we're calling when there's a case and asking them kind of intimate details, like where have you been all of the times in the last so many hours. And most of us might have places we might want to say where we've been. And yet it's important that we get people to answer the phone and do that. And we think if people could track down some of these cases, that people may be reluctant to give the answers. Now, I will tell you the story that I was on a call earlier this week with a couple of other public health departments. And they said, boy, we can't get anybody to answer the phone. When we call with this, people answer the phone, find out it's us, and hang up. We have not had that experience. And when we said, well, why do you think it's so different in that area? They said, well, people in these other areas where people aren't answering the phone are worried that if they talk to us, that the word is going to get out of who they are and where they live. We are just not going to do that. And so we have actually been pretty adamant that we're not going to try and release information that would allow all you sleuths out there to figure out who these people are, so that people will still talk to us. Because once people stop talking to us, our job is going to get so much harder. Okay, a couple of things. CDC came out with some studies, and actually this was finally a CDC page I really liked. It looked at the diseases that made you higher risk, and they are kidney disease, COPD, a solid organ transplant like a heart, lung, or kidney, obesity, heart disease, sickle cell disease, and type 2 diabetes. So these are the ones that actually have good evidence that you are likely to be high risk. And then they put down another group of these might put you at higher risk, and these included things like smoking, immune conditions, pregnancy, and cystic fibrosis, and then ones where there's not a lot of evidence. And then what they did is there was a page, where's the evidence? And you clicked on where's the evidence, and it showed you what the evidence is. This is what we've been asking for months. It's finally out today. So that was my favorite thing that I saw on the web today, which is the CDC list of high-risk conditions with the data behind it. Because you remember, people have been asking a lot of questions, is such and such a disease? And I have to say, well, in that one little study I saw, there was a little trend one way or another. This is good because somebody has pulled together all the data and they put the evidence there. So if you want to see it, if you think you have a high-risk condition, please get there and see. Now, one of the things that was striking is that smoking was not considered to be was not definitely a high-risk condition, which is surprising. Yeah, so someone says if a patient is in a dementia care facility is placed in hospice, are they allowed visitors? So the visiting rules in facilities, hospitals, long-term care facilities, is based on the facility itself. So throughout the state, there are different rules about who can and can't go. I actually made a house call today and went to talk with a family who had a kid who just came home from the hospital, and they were talking about the differing rules for visitors. So I would certainly talk with them and find out what their rules are. So Catherine says, what advice would you give a hotel housekeeper so they don't get this? Well, the good news is we don't think hotel housekeepers are particularly high risk. So that's the good news. So again, this is usually done by person-to-person contact. We don't think this hangs around in the air for very long. Let's say you wanted to be super duper careful and not get it. There are a couple of things that you could do. One is you could wait an hour until the person leaves the room. Almost all aerosols are down an hour, so that if you worried about aerosols, they wouldn't be there. The second is certainly don't do all the other persons in the room. The third is to wear gloves, and they don't have to be anything special. They can be just regular rubber gloves like you'd use to do the dishes, and to just do the regular cleaning you would do. So we're in a little bit of a beef with the hotel industry because they worry that, oh, well, maybe somebody who stayed there might have had it. And the answer is, yeah, you should think that anytime you clean the room, somebody there could have had it. But there's other diseases that we don't worry as much about, but are much more contagious, things like norovirus, and we don't do anything special. So I think you want to be careful. I think if you wore gloves when you clean the room, that would be not unreasonable. If you let it sit for an hour before you clean it, I didn't think that would be unreasonable. And if you were worried you could wear a mask, again, I don't think masks will help you that much. Okay, so questions just a few more questions. If you have questions, let us know. The vaccines do seem to be progressing, as we talked a little bit earlier. We have several in phase 3, and that's a good thing. Bill Gates was on the other day, was on CNN the other day. He seems to know a lot about vaccines, and his sense was that we're making good progress. And so what he and the other vaccine guy who was on is saying is that the road to vaccine development looks always pretty short, and like, why don't we just have vaccines all the time, but that there's frequently a barrier in the way that you can't see. So you make a vaccine, you think this is going to work, you get good antibodies, but then you find the antibodies aren't really protected against disease. Or you make the vaccine and the vaccine comes out, but then there's a side effect you don't expect. So for example, about 20 some odd years ago, there was a vaccine against a viral disease in kids called rotavirus. And when the vaccine came out, it looked like a good vaccine. It seemed to work, but in about 1 in 10,000 times, kids got a rare intestinal condition called intussusception. And so that was not acceptable, and that vaccine was pulled. And again, you're not going to know that until you've given 100,000 doses. Or that you do the vaccine and people won't take it, right? They won't take it for one reason or another. They don't feel it's safe, they don't feel it's effective, they want to have other people do it. And again, if only a quarter of the people take the vaccine, is not going to really do much to get rid of the disease. Now, it may help you a little bit. And then the last question is, does it need to get repeated? So for example, measles, mumps, rubella vaccine, if you get a dose at 1 and then again at 4, you almost always have great antibody protection. However, there's some vaccines not so much, like the influenza vaccine. If you get influenza vaccine, maybe 50 or 60% effective, and some vaccines require multiple doses. So for people like tetanus, you need multiple doses, so we don't know those things. So he was saying it does seem like they're progressing. It seems like they're progressing well, but there's a lot of things along the way that there's no way to predict. Okay, 6:55. They're telling me it's time to go and have dinner. Okay, again, this is Dr. Bob Dannenhoffer. Now I have a very special thing. I know people make their calendars around these Facebook Live things, but because of a change in our schedule, instead of doing these on Mondays and Fridays, we're going to do these on Tuesdays and Fridays, same time, 6 o'clock. We're going to be on Tuesdays and Fridays. This will help in a couple of ways with the way data is gathered for us to go ahead and get you the best, most up-to-date data. So again, next Tuesday at 6 o'clock and then Friday 6 o'clock until we've beaten this thing back. But unfortunately, I think that's going to be a while. Again, this is Dr. Bob Dannenhoffer with another Facebook Live. Thank you for joining us, and we'll see you again next Tuesday, not Monday.